The views and opinions expressed on Real Talk with Horace Sheffield are not those of WADL TV 38 or Adele Broadcasting Corporation.
Giving you real talk, real talk, real talk. Take a walk down this path through Detroit, This is real talk, real talk, real talk. Real issues straight from the heart. Giving you real talk, real talk, real talk. Take a walk down this path through Detroit, This is real talk.
Well, welcome to another edition of Real Talk. I'm Reverend Sheffield. To your left is my co-host, Gerald Smith, award-winning journalist, fantastic voice of back-to-back, and of course, Meoni Hurd, who is a community health worker here at the Detroit Association of Black Organizations, doing a tremendous job on helping us address hypertension. The numbers that we know of from the CDC and other entities is that 50% of Detroiters have some form of hypertension. We were told 60-some% of them who have it don't have it under control. But Meoni, you know the numbers, and our numbers are a little bit different based on the folks we've been servicing. So why don't we start there? How prevalent is high blood pressure, and how many of the folks who have it don't have it under control?
High blood pressure or hypertension within our community, especially for those individuals that come into the Dabo Center to get tested, is quite high. Almost, I want to say a good 70% out of a good 100% of individuals are tested and positive for having high blood pressure and are getting enrolled into our program. So it's quite high.
Okay. And so the second question is, explain how our program, because our program is so novel that it's being presented as a scientific model at a national gathering of scientists, because we've been able to reduce their blood pressure and keep it under control in a time frame that's unheard of. Is it like less than 10 days?
Yes, so 7 to 10 days is what we're seeing progress and with our patients that we have enrolled in the program. It's a really good program. Did you want me to go ahead and step into?
Go ahead, and then Gerald will ask a question after that, yes.
Okay, perfect. So first, I just want to give a little bit of background on what hypertension or high blood pressure is. We hear this term quite often, but what does that really mean? So according to the American Heart Association, high blood pressure or hypertension means that the pressure in your arteries is higher than it actually should be. It's so dangerous because there usually are no symptoms or signs that alert you that you do have high blood pressure or hypertension. Uncontrolled high blood pressure or hypertension can lead to strokes, heart attacks, heart failure, kidney disease, and many more things as well. So we have a great blood pressure management program here. It's a very simple program, yet it's highly effective. During the 16 weeks, we have a cardiologist that will be the patient specialist during this program, focusing specifically on their blood pressure. He's going to actively monitor their blood pressure, and this is all going to be virtual. With the blood pressure cuff that the patient receives during their enrollment here at the Dabo Center. It's a very nice blood pressure cuff. It actually has a value of about $110, so it's extremely great. It's been designed specifically for this program here. The doctor receives the blood pressure reading every time the patient actually takes it, so they don't have to write anything down unless they wanted to for their own sakes. However, every time they turn that blood pressure cuff on, the doctor receives that reading. We typically recommend that they do that twice a day, but the more times that we have our patients take their blood pressure, the more data that the doctor has to better assist and put together that plan of action for them.
Okay. Gerald?
And thank you for the great work that you've undertaken and the results that you have achieved thus far. But what are some of the most greatest challenges that you face right now with respect to, and you just mentioned the fact that a lot of people don't know that they are asymptomatic. They don't know. How do you get people in there to get treated and get tested?
Yes, so we're doing a really good job of bringing individuals in. Thanks to Reverend Sheffield, we have a really good client base here. Most individuals that come in, what we're doing is we're educating our community. We're letting them know what the consequences are, why we want them in this program, and ultimately, we want to see everyone within our community continuing to live and be here for their loved ones and be here with their family so that they can continue on. So the biggest thing that we're doing is encouraging, educating, and combating when we have individuals that want to decline participation in the program. I never take a no for an answer. I always go in, I ask again, why don't you want to join the program? It's a completely free program. We're basically giving you help. We're giving you access to specialists, which can cost hundreds and hundreds of dollars if you were to go to your actual provider or go through your hospital and do it that way. So educating and encouraging, and don't take no for an answer, is the strategy that the community health team here is using to actually get people enrolled into this program.
And what makes this program so novel? You mentioned the Bluetooth reading of the pressure cups that people take home. We don't charge you for anything. We don't bill your medicine. We're not billing private insurance for all this. But what makes it great and different is if you have a primary care physician, sometimes, you only go but once a year, twice a year. You don't know your blood pressure is high, so you're not even alarmed. You're not even aware. But with this one, the doctor from Harvard, by the way, actually can titrate your medication. So based on where you are, in real time. You're not waiting 6 months where damage can be done. It's being done almost immediately. So I know there's been people, because I've talked to a few people who've just been really grateful. One person told me that their blood pressure was like, they didn't know how they were walking around. And now they have it down to normal. They sent me a picture of the normal glow on that meter. I guess when it glows a certain way if it's normal.
Yes, it does. It glows green. We have quite a few patients that have been enrolled in our program, that have been very active in the program and that are raving about the results. I just had someone come in the other day, actually, just specifically to tell us how well the program has worked for them. They were already on blood pressure medication with their primary care provider. They've been on it for quite a while, but their blood pressure just still wasn't getting under control. They got into our program. They've been in the program for about 3 weeks now, and their blood pressure is now reading normal levels. So they specifically came in to let us know that the program is working for them.
Yep. Gerald?
So Miani, where should a person go to get tested? I mean, what are the hours? What's the website or whatever? I don't mean to upstage to rev on this program, but I think it's so important that you continuously get the word out about how people can use these services.
Yeah, so you can go to yourbloodpressurematters.org. You can set up an appointment on that website. There's also more information about having high blood pressure on the website as well. If you didn't want to make an appointment, you certainly could just walk right into the Dabo Clinic here. We're at 12048 Grand River Avenue. You can walk right in Monday through Friday, 9 a.m. to 2 p.m. We are here doing testing and getting patients enrolled. So again, that's Monday through Friday, 9 a.m. to 2 p.m. here at the Dabo Clinic.
So one of the highlights, obviously, besides helping people get their blood pressure under control, is that Mike Epps came by.
Yes.
And why don't you talk about that? Because he is one of our spokespersons for our Blood Pressure Matters program.
Yes, he actually came here not too long ago in June sometime, had a really good turnout for this. Lots of people came in. He was very friendly. He spoke with all of our community members that we had here on site. And he just is encouraging individuals to take high blood pressure or hypertension, take it very seriously, because we have it so much within our community, whether it's a hereditary thing, it has to do with race, ethnicity, and many other reasons. But he's basically encouraging our community to take this serious. This is nothing to play with.
Yeah. So we're going to get out of here now, but we're going to end with the video of Mike Epps and the blood pressure commercial that he and I cut together in Milwaukee, Wisconsin. We thank you for being on our show, and it's been a delight to have you, and we're going to have you back real soon. We'll come right back after this, after you see Mike Epps and me.
Hi, I'm Reverend Sheffield, and
I'm comedian Mike Epps.
And we're here on behalf of Detroit Association of Black Organizations.
High blood pressure is getting out of control in the city of Detroit, and we're here so we can help all our people in the community with hypertension, and the problem with high blood pressure is not a joke.
And almost 49% of Detroiters have some form of hypertension. We're here to help control that. Go to yourbloodpressurematters.com or call 313-491-0003.
I'm Wayne County Treasurer Eric Sabri, encouraging all taxpayers to please take advantage of the several payment options available. If you have to visit our office in person, you must make an appointment by going to treasurer.waynecounty.com. It only takes a few minutes. Facial covering or mask is required and social distancing is observed. You can also email our office at taxinfo@waynecounty.com or call us at 313-224-5990.
Well, welcome back. We've been talking about health. We just had Mioni Hurd on our community health workers on, and now we're going to talk about the menthol ban. And we have the person who's in Premature, whose leadership is behind that effort here in Detroit and Michigan, Manu Carey Jones, who we're also blessed to have as our coordinator of our Health Disparity Council. Welcome, Manu.
Thank you. Thank you for having me, Reverend Sheffield, and for being a fierce and, brave leader alongside with me in this effort.
Sure. Gerald, why don't you start? You've had some questions and an opportunity to look into this.
Yeah. So Manu, thank you for joining us today. So right off the top, is the FDA banning? Let me put it this way: is the FDA banning menthol cigarettes? There's a lot of talk that they were doing something back in this a few months ago, but what's the status right now?
So we are in a holding pattern right now with the FDA. Back in April of this year, the FDA did announce that they were going to move forward with the proposed ban on menthol in cigarettes. And there was a public comment period. I actually spoke at one of the listening sessions, and public comments closed on August 2nd. So now we are in a holding pattern waiting for FDA to move forward with the proposed ban. And time equals lives. So
Yes.
we need them to do what they should have did back in 2010 on this issue when they banned all other flavored cigarettes.
Right, except this one, which adversely affects predominantly people of color. So the holding pattern has a lot to do with why we see R.J. Reynolds and other subordinate entities funding people, trying to influence public policy. I was amazed. I've done a lot of things, Manu, but the people that I heard from all over this country about this issue was laudatory and congratulatory. And I just had no idea that this struck such a chord with so many people.
Yeah, it's sad that, we connect on an issue of losing loved ones to the profit of the tobacco industry. There are other municipalities throughout the country that have passed local ordinances to ban, mentholated tobacco products and all flavored tobacco products. We need that to happen here. Waiting on the FDA to do that is, to our detriment.
Yeah.
What?
David?
Yeah. Thanks again for being with us, Manu. What steps or initiatives are you doing locally to affect or try to change or make people aware of what's going on?
Yeah, so I chair the Detroit Wayne Oakland Tobacco Free Coalition. We meet every third Friday of the month from 9:30 to 11, and we have over 100 members who are part of that coalition, because this is really about having a community-driven effort. So DABO is a part of that, American Lung, American Heart, American Cancer Society, they are a part of that. My own organization, of course, Making It Count, is a part of that. Coalition for Black Trade Unionists are a part of that. We have over 100 members, and they're both local, state, and national. So, we need more people to be involved. We have a campaign website, endmenthol.org, where people can go on and sign the resolution of support as an individual as well as an organization.
Yeah, I think it's important for people to know why this is so important. In other words, cigarette smoking is hazardous to your health. And that long battle we went through to even put a warning on the cigarette packages. But menthol cigarettes are worse in general, but more specifically because we're the ones who principally buy them and smoke them.
Yeah. Yeah. So in the 1950s, African Americans smoked, 5% of African Americans who smoked used mentholated products. Today, African American smokers almost exclusively smoke menthol. It's more than 85%. And, the detriment and the devastating part is, and I've heard my parents who, my father suffers with emphysema say, oh no, I only smoke menthol. The other stuff is too harsh. But that's, the trick of it is that the menthol makes the poison go down smoother. It is deadly, make no mistake. But it, has a soothing, cooling effect that makes the poison go down easier. And as a result, we smoke more. It's harder for us to quit, and we have higher rates of death and disease associated with it.
So this was a devil with a dress on, basically.
That's that.
But I think, the percentage of folks in our community that comprise those who consume these cigarettes, as you said, 80% plus. But it's not only that, it's the marketing.
Oh,
What they've done over the years to specifically target our community. Can you speak to that?
yeah. I mean, if you think about the civil rights movement, when we were fighting for our rights, the tobacco industry was already way ahead of that. They were using black athletes, they were using our entertainers in their advertising. So on one end, it was like, yeah, finally we're seeing black faces in our magazines, and our magazines are being funded, but it was being funded by the tobacco industry, and they're never been our friends. They are about profit and their bottom line. So it's been to our detriment. If you think about the Cool Mix Jazz Festival, that was the tobacco industry in the background, enticing us with their music and, letting us listen to those wonderful sounds while they were passing out free cigarettes and, their brand at those festivals to us.
So I have the last question. So part of the response with the stories I've done from RJ Reynolds is that, yeah, we do fund organizations, but there's no expectation that they advance, our products or whatever. I mean, can you just debunk that? People don't give you money. I mean, it's like a guy telling me, he bought a girl a car and he don't want to kiss.
Yeah, I mean, the bottom line is they are using our people, who look like us, who pray with us, PRAY, to pray, PREY, on us. And it's sad and it's a shame, but it's the truth. And I commend you again, Reverend Sheffield, for stepping up as a strong, fierce leader in Detroit, who's known throughout the country and even in other countries to step up on this issue. $250,000 is not money to laugh at, but if you compare that to the cost of Black lives, we're losing 45,000 Black lives each year to tobacco.
All right, I'm out of time. Tell people how they can reach you to help.
Please, you can reach me directly at mjones@the letter U, make it count.org, and visit our website, www.endmenthol.org.
And we'll have you back on soon to talk about the health disparity councils, of which these cigarettes contribute to.
Yes,
We'll be right
yes.
back after this break. Thank you.
Thank you so much.
Thank you, guys. I appreciate it. We got a
All
show
right.
for the day. Thank you.
Okay.
I grew up with one of the most horrific statements that can be made in anybody's household, and that was, what goes on in the house stays in the house. And for me, and as a Black family, that nearly destroyed us. And it wasn't long after that, my nephew, 14 years old, hung himself. Wasn't long after that. The 988 dialing code is just the first step towards strengthening and transforming crisis care in this country.
It serves as a universal entry point so that no matter where you live, you can reach a trained crisis counselor who can help.
988 offers 24/7 access to trained crisis counselors who can help people experiencing suicidal, substance abuse, and other mental health crises.
To reach the Lifeline, people can call or text 988 or chat 988lifeline.org.
988 is more than just an easy to remember number. It's a direct connection to compassionate, accessible care and support for anyone experiencing mental health related distress.
But we're at a moment in time now where we have to indeed break that cycle and be open to a number of things that are happening in our families, especially in the Black church.
You may be the person that stands between them and that ultimate irreversible decision.
Thank you for calling the Lifeline. How may I help you?
Well, welcome back to our final edition of Real Talk. I'm Reverend Sheffield. I think you've met our new producer, Gerald Smith, before. You certainly know David Felton, my co-host here, my co-host on the radio show. And of course, he's a vice president of Able. How you guys doing today?
Great.
Doing wonderful, sir.
I thought it'd be good to have a little male bonding kind of conversation, talk about a plethora of things. And I wanted to start with the Lions because, you know, David and I, we really are NFL fans. So we'll come in last. But Gerald, do you believe the hype? Do you think they're going to be better or what?
You know what? I sincerely believe, Rev and Dave, that they will win twice as many games as they did last season.
Okay.
Which is what, 6 games?
And that was based on what?
Well, you know what? I'm looking at a couple of things here real quickly. This training camp this season, they brought in a couple of new coaches, assistant coaches, a couple of black coaches. And I think that Coach Campbell is doing some things that I think other coaches around the NFL is not doing. And that's empowering his coaches to teach and bond with his players.
Mm-hmm.
I think that'll go a long way.
They're like Deuce Staley, who got into someone's rear end. I think it's the rookie runner. You know about that, right? Don't you, David?
Briefly, I heard a little bit about it. Yes.
Yeah. So I guess he was saying that he wasn't cutting right, or whatever. He just like he showed him the tape, and the guy was a little upset at first, but he was saying, "Man, I'm here to help you be a better runner. You gotta shoot that gap. You got
right
runners on. This is a fast league, and if you don't accelerate immediately, by the time you get going, the linebackers and even these huge defensive linemen who are running, unbelievable 40s will get you."
Yeah, what do you guys think about this Hard Knocks thing? A lot of people around that normally wouldn't follow football or follow the Lions are really into the Lions now, and they actually, people are talking about they wish they would do this every year. It introduces the players to the community and to the fans. It gets them a little bit more comfortable with them. I know we want them to win, but what do you think about that?
Referring to the TV program, Hard Knocks?
Yes, sir.
Yeah, they've done that in training camps before, and I was really amazed that the Lions got the focus that it did, and I think that's part of the reason some of my whole attitude about this season has changed. Not to mention the fact that they've won their first preseason game in 8 or 9. But I do think it presents a different culture of the team. What do you think, Gerald?
I think you dyed in the wool. Lions fans, I appreciate you all for sticking up for the Detroit crew. But again, I harken back to one key point, and that's the fact we're talking about Hard Knocks right now. It's the fact that what's making that program are the black coaches. They are really bringing something to the table and really formulating a real strategy for the team to kind of follow.
So
it's making for good television.
So you think it's the black coaches?
Yes, okay. Clearly.
Okay. Well, I think in the fullness of time, I mean, at a certain period of time, you lose long enough, it's almost time for you to win.
It's inevitable, huh?
All right. So you said they're going to win 6, right?
Yes.
How many? Is it 1 or 2 extra games this year?
They play what, 17?
I thought they were playing 18 this year. They used to play 16.
So there's 1 additional game, and they got rid of one of the preseason games to add an additional game to the season.
Oh,
so give me, you saying they're going to go 6-12?
Yes.
6-12.
Yes.
All right. What about you, David?
I'll go 8-10.
Okay. I'll go 10-8.
You documenting this, right? So somebody can take somebody out.
Yeah, we can come back and have a whole show on it if you like.
You are dyed in the wool, Rev.
No. I have not been optimistic about this team for years. I didn't even I went to 1 game last year. And by the way, I'm gonna let David go to the season opener because I'll be recovering from my my knee replacement. So he can go down there and tell me whether I've been smoking something.
Well, don't forget your other co-host.
Yeah, well, maybe you two go together. So we'll figure that out. The last question I gotta have this, Tudor Dixon. What is your predictions or your assessment of the race for governor? Because the last poll, Gretchen was only up by 4.
Gretchen in a romp.
In a what?
In a romp. R-O-M-P, a romp.
Oh, you think she's going to win hands down?
Oh, yeah. Yeah, no doubt about it. The women, man, I talked to a lot of women, black and white, others. This whole abortion piece, man, reproduction piece, man, they're not going for this other lady.
Right, right. Well, that seems to be her Achilles heel. But I've talked to other people who look at women as being attractive or non-attractive, and their assessment of the race is she's prettier than Gretchen. What do you think, David?
Yeah, I'm not sure about I'm not sure about that. From the standpoint of the businesses being closed, no. I think that, that I think she's trying to do that thing, with small businesses. And so she might have an in there, Gerald, with some women business owners who had to shut down during COVID.
Yeah.
David,
so I'm gonna wait.
I'm sorry, David. She has Mr. Trump as her key ally and supporter. Every time you see his orifice on television, man, that's she loses votes.
Every time you see her orifice just stand still, she might be coming out of it, huh?
Stop it.
Right.
All right, we got a minute and a half. What is your prediction of where all this Mar-a-Lago and all the stuff that seems to be closing in on Trump? Is Trump going to ever be indicted? Is this going to be his downfall, or is this going to continue? David, you go first.
Well, it seems as though what I've been reading, what I've been hearing is that he will be indicted. How far to go, I'm not sure, but based on his actions and the DOJ, and if it was any other person, they'll be indicted. Now, if he's actually prosecuted or anything like that, I don't know, but they said the indictment is on the way, according to what I've been reading.
Indictment is prosecution. You go right ahead, Gerald.
And
I mean,
go ahead, David.
I'm sorry, you're correct, sir. I meant actually go to jail, do some time.
Convicted, right.
Convicted. Thank you, sir.
Smoke and mirrors, Rev. Smoke and mirrors. Nothing's going to happen. Nothing.
Yeah.
Zero.
Yeah. I think these white folks are afraid of what would happen if they did charge him.
You're right.
You see what's happened to the FBI and everything else. And I think that's why he's been emboldened, because he's put fear in them. And they're afraid. They're talking about we're losing democracy. Hell, he'll blow it up if he get indicted.
Exactly, Rev. And some of his people are still in some of these strategic places in government. So,
All right, we had a great time talking to you guys. We're going to get a camera crew soon when I get my knee done. We're going to go out to some barbershops and do a whole show, sitting in barbershops, talking with black men. Black men's opinions matter. See you next week. Thank you, Dave. Thank you, Gerald.
Detroit, this is real talk, real issues straight from the heart, giving you real talk, Take a walk down this path through Detroit, this is real talk, real talk.